Hello, my name is Paris Mandy. Today I'll be talking to you about sickle cell disease. During this presentation, we will talk about sickle cell disease, the pathophysiology, the clinical manifestations, and the treatment as we review a case study of an 18-year-old individual male who has sickle cell. IT is an 18-year-old African American male diagnosed with sickle cell anemia. Today he is in a pain crisis. His pain is localized to his arms and his legs, and he's had no relief with 400 milligrams of ibuprofen every 6 hours. Today his pain is moderate to severe. He lives daily with pain, but this pain is worse post 36 hours after his workout. He states that he shouldn't have overdone it, but the guys needed a sixth player for a 3-on-3 basketball, and he forgot his water bottle. So, as he stated, he knows that he overdid it. He played too hard. He did too much at the gym. And what made it worse for him, and is one of the reasons why he's in a pain crisis, is that he forgot his water bottle. Past medical history, was diagnosed with sickle cell disease at 11 months. He's presented with the swelling and pain in both hands and feet. When he was 30 and 34 months, he was hospitalized for streptococcus pneumonia. At 13 years old, he was diagnosed with staphylococcus osteomyelitis of the left knee. On average, he has about 3 painful crises a year, but he can have up to 10. He was born with hypospatus. He had a tonsillectomy, childhood asthma, chronic sinus drainage. The medications that he takes are folic acid 1 milligram, ibuprofen 400 milligrams 3 times a day as needed, and he takes phenylcide 2 sprays each nostril as needed. Family history. His mother and father are both alive and well, but they both test positive for the sickle cell trait. He has a brother who is 17, also alive and well with the sickle cell trait. We will talk more about how he has sickle cell disease and his brother only has the trait. His parents are divorced. He lives at home with his mom during the summer and then dorms during the school year. He also works part-time as a cashier. He denies drinking alcohol, smoking, or doing any other drugs, but he does admit to drinking about 2 to 3 caffeinated drinks a day, which again does not help him because caffeinated drinks will dehydrate him even more. He likes to get as much exercise as he can. Unfortunately, he finds that he overdoes it more often than he should, so he needs to listen to his body more. Physical exam. He presents as a tall, thin African American male. He is in moderate to severe pain. His vitals are really good. Blood pressure is 95/60. His pulse is 58. Respiration is 18. His temperature is normal, 98.5. Oxygen is 95% on room air. And his BMI is 18.7. So he's a thin guy, but he's very healthy. His skin was warm, dry, but he had poor turgor and some tinting, a sign of dehydration. His lips were dry and he had dry mucous membranes, also a sign of dehydration. There is a systolic ejection murmur heard. He has limited range of motion in his elbows, wrists, knees, and ankles due to the pain. With a peripheral blood smear, he is positive for sickled and crescent forms of red blood cells. The pathophysiology. This is an inherited autosomal recessive disorder. So both of your parents need to have it, and then there is a 1 in 4 chance that you will get the disease. So both of the parents must pass on the trait. The child can receive the trait, but they don't always have sickle cell disease from receiving the trait. The parents need to give them both, or give both traits to the kid, and that's how they will get sickle cell disease. It is a lifelong disease unless there is a bone marrow or stem cell transplant. These are very rare because it's hard to find a match. This disease affects African American more than any other racial or cultural group. So 1 out of 500 African Americans in the U.S. Will have sickle cell disease. It can be identified through a routine blood screening. Pathophysiology continued. The sickled red blood cell. This is a genetic mutation within the amino acid. So the valine, which is an amino acid, replaces the glutamic acid. The sickled hemoglobin then reacts to deoxygenated and dehydration by solidifying and stretching. So that's when it makes that elongated sickled shape. The sickle cells are stiff. They do not change very easily like normal cells. Therefore, they can easily pile up in the vessels, causing occlusion, pain, and organ infarction. Sickle cells undergoes the hemolysis in the spleen. This can cause the blood to pool in the spleen. The cells regain normal shape after reoxygenation and rehydration. So as you can see with the diagram here, how easy it is for those sickle cells to pile up within a blood vessel, which then causes an occlusion. The clinical manifestations of sickle cell disease is going to be the anemia. Anemia is going to be the main symptom of this because of the way the sickle cells have difficulty carrying oxygen throughout the rest of the body. So you will see a patient who looks pale. They can be very tired and jaundice and irritable. When they have extensive sickling, they will find themselves in a vaso-occlusive crisis, an aplastic crisis, sequestration crisis, hyperhemolytic crisis, acute chest syndrome, as well as other manifestations. So a vaso-occlusive crisis, this is when the blood flow becomes obstructed by the rigid sickle cells. This crisis can last on average 4 to 6 days, but it is not uncommon for this to last for several weeks. It's essentially a log jam. So the sickle cells become jammed inside a vessel. This can cause tissue death unless it's reversed pretty quickly. It can be precipitated by infection, being in the extreme cold, dehydration, and low oxygen. So a patient like this should probably not go to Flagstaff, Arizona, where the elevation is high and the temperature is cold in the wintertime. This patient will have hand-foot syndrome. This is the swelling and pain within the hands and feet. Then you have the aplastic crisis. This is caused by a viral infection. And this is pretty much anemia, so there's going to be a rapid stop in the production of red blood cells and then a severe drop in hemoglobin. This patient in the aplastic crisis will be a candidate for a blood transfusion. The sequestration crisis, this is when the blood becomes pooled in the spleen. You're going to find this crisis more in children. If this is a recurrent crisis, they may do a splenectomy or even a partial splenectomy. The hyperhemolytic crisis, this is the accelerated rate of RBC destruction. This is caused by an infection or sometimes the use of drugs. And this will present as anemia. So you'll see the classic signs of anemia, including jaundice. Organ complication. There is so much that happens to your organs within a patient who has sickle cell disease. They might find themselves with acute chest syndrome. This is when you might find some pulmonary infiltrates looking like pneumonia. They may have a temperature, increased respiratory rate, tachypnea, wheezing, and a cough. Then you might find that they are prone to cholecystitis, spleen complications, so splenic sequestration or splenomegaly, gallstones, as well as lung complications where they might have atelectasis. This is just when there is an incomplete expansion or an infarction, pneumonia. Brain, this is going to be where you want to teach the patient the signs and symptoms of stroke, because through the thrombosis they can have a stroke as well as a hemorrhagic stroke. Eyes, this patients might have retinopathy, some blindness and exudation. Their heart, they can experience the acute chest syndrome as well as high output or congestive heart failure. Kidney, be careful for blood in the urine. Skin, they might get ulcers that will need wound care to follow up with, because they have poor circulation, especially in children where they're developing ulcers. Treatment. Again, there's no long-term treatment. The treatment is based on prevention. So preventing fever, dehydration, infection, acidosis, exposure to cold. They shouldn't wear constricting clothes. These patients definitely need to get their annual vaccines, pneumonia vaccine, flu vaccine, but also be up to date with all their shots. These patients might receive blood transfusions during their anemic states. They should take a folic acid daily. The definite treatment, again, is a stem cell transplant, bone marrow transplant. These patients will have a huge focus on pain management. Are they going to manage their pain with NSAIDs? Are they going to manage their pain with narcotics or other modalities? During the sequestration crisis, they might get a laparoscopic splenectomy or a partial splenectomy. But the main thing to treat this is going to be IV fluids, if they are in the hospital, so IV fluids as well as IV pain medication. But once they get rehydrated and once they get reoxygenated, some of their blood vessels will go back to normal, and that will reverse some of that pain and that crisis. So the biggest thing is oxygen and hydration. So teaching for IT, he needs to be alert for any signs and symptoms of infection. Know his body when he's getting a fever, when he's feeling tired, or getting short of breath with doing normal activities such as walking to and from the bathroom. Swollen and painful red or hot hands, feet, or belly. This is another sign of a crisis. He needs to know signs of dehydration. Manage any type of wounds that he has, especially any ulcers on the bony prominences if he's having difficulty with blood flow and circulation. Notice any yellowing of his eyes or the skin. Priapism, as a male, he needs to be aware if he's having an erection that lasts too long. He might need to go into the hospital if he's having moderate to severe pain that he can't alleviate at home. He needs to know the signs and symptoms of stroke. So that's going to be speech, weakness, arms and legs, and the facial droop. He wants to continue to get plenty of exercise, but not overdo it. It depends on his provider, but he might want to avoid some of the physical contact sports. Obviously, he plays basketball, but maybe his provider might not recommend that he plays football or rugby. Drink plenty of fluids. Make sure that he wears warm clothes during the winter. He also might need to wear warm clothes when he's inside during the summer because of air conditioning. And those are my references. Thank you for listening.